Welcome to Conversations with Kay. I'm Kay Ryder. And every week I talk with Vermonters who are leaders in the fields of government, healthcare, education, the arts, and community life. And welcome to our radio listeners, 99.3 FM, WBVT LP. Our guest is Ann Pugh, and she is the chair of the House Committee on Human Services in the Vermont House. Welcome back.
Thank you, Kay. Thank you for having me.
Good to have you always. How long have you been a member of the Vermont House?
Since 1993, I believe.
Okay. Well, it's an anniversary year for you.
It is.
Yeah, almost. Okay. How long have you been chair of the Committee on Human Services?
Since Gay Symington became Speaker, so I think about 14 years.
Okay, good. Now, you have never wanted to ascend to the Vermont Senate. Is that true?
I've never wanted to be in the Vermont Senate. I do not necessarily see the Senate as a higher office.
Oh.
I really like what I do. I like representing South Burlington. I'm able to go to meetings, and I believe I do a better job of keeping to my community, and part of that is because I work full-time at the University of Vermont teaching social work, and I would not be able, I think, to do as much justice as the representative, or as a senator, because that is so
big territory.
Yeah.
Yeah, right. You are a social worker. You've done it for a long time. Do you feel that this occupation brings certain skills to being a legislator?
Absolutely. We know how to listen. We know how to be non-judgmental, how to bring people of different perspectives all to the table and to come to a plan in the world of social work and to figure out how to move forward. And so I think that those are some of the skills that I learned in social work school.
Yeah. Well, you mentioned listening. I think a lot of people don't listen well. They don't communicate well. And it's very important to listen.
If I'm going to learn, I need to hear and listen and not think about what I'm going to say.
Doesn't it drive you crazy when you're talking to someone and you can just see they can't wait to butt in?
It's human nature.
Certainly is. You're a Democrat.
I am.
And the Democratic Party in the state of Vermont had large majorities in the House and the Senate. Yet you didn't pass legislation which both houses said was very important for them. Now, in your case, in the legislature, you wanted to pass a family and medical leave program, and that didn't go through. And then the Senate had the what did the Senate have? The Senate had
minimum wage.
Minimum wage, and you didn't do these things, and you had said up front of the legislative session, this is what we're going to do. Now, why didn't it happen?
Okay, I want to begin with, there were more than 100 bills that we passed and that were signed by the governor and that were things that Vermonters wanted.
Yep.
We put more money into childcare. We made various small initiatives related to climate change, and the list goes on. In terms of those two initiatives, paid family and medical leave and minimum wage, one, not all Democrats think exactly the same way. And the House passed a bill, and the Senate had a different view of how to bring family leave, paid medical and family leave, forward. The House passed a minimum wage bill, and the Senate had a different idea. The goals are the same, but we weren't able, the first year, we said we were going to do this. The legislative session is 2 years long.
Okay, so next year we can
Absolutely.
No, well, that's good. I approve of both. I mean, for obvious reasons. And why do Vermonters, or in any state, why do you need medical and family leave? Why is it so important? It's not just a women's issue.
It's a Vermont issue. It's an issue for employers. It's an issue for families. We can go down the line. We have an aging population, and we have a lot of people who are employed who are both parents and taking care of their parents. You have emergencies. You have illness, or you have death in the family or other crises, and people are more likely to take care of them and return to work if they have paid family and medical leave. And that helps employers because it costs so much to retrain or to hire someone new. And employers are going to, I would say it's something that the younger generation, people younger than me, it's very important to them, and it is something that we can say, look, in Vermont, this is something that you would be eligible for, and that would be, I think, and that we heard would be a good reason, another plus for people staying in Vermont and for people, young families moving to Vermont.
Right, we need workers in Vermont.
We need workers, we need families, we need people to be able to do their job.
Yeah, right. The people who take care of aging parents and their own children are called the sandwich generation.
Exactly.
I mean, that describes it completely. I mean, you're just stuck right in the middle.
It is, and so those things. I mean, those things are very important. A tiny little personal story. When I first moved to Vermont to work in an organization, I was very lucky that organization had paid leave, because I wasn't in Vermont for more than 2 months when my mother went into the hospital and she was going to die.
Oh dear.
And every weekend I left early every Friday, so that I could drive to New York where I had grown up. Yeah. And if I had been working at a place that did not allow me that flexibility and did not, and I was able to use paid leave to take that, I might not have stayed in Vermont.
Right. I think there are a lot of women out there like you and me who would have a story about why they needed this. Absolutely. I'm talking with Ann Pugh, and she's the chair of the Vermont House Committee on Human Services. Let's go on here to children a little bit here. I like to talk about kids because children can't vote, as you know. So all these organizations and good people out there have to advocate for them, and which is very, very important. Should the state regulate toxic and hazardous substances that are in products for children?
We absolutely should, and we actually do. It was, I believe, in 2008 we passed some legislation that wasn't being implemented. It wasn't as effective as we wanted to. So this past year we passed some legislation to begin to move forward on that in terms of what we have and what we've done is a first step. We need to perhaps what we need to do on some level is make it more understandable to parents and grandparents and people who are buying things for kids, so they can, when they go to the store, they can know, rather than have things done by chemicals, and that's what the list is now.
Right. There are some chemicals which are extremely dangerous for children, and kids put everything in their mouth.
Exactly, and we have some of that data. The health department posts some of that data, but they post it by chemical names or things like
dimethyl so and so,
or the name of the manufacturer and that. So we have to figure out how to make it more user friendly and more effective.
In other words, how to put it in plain English.
Yeah.
Put it in plain English so people will understand.
So people like me who was not a chemistry major might know.
Yep, right, okay. Speaking of chemistry and chemicals and all those good things, Vermont has a big opioid problem, as many states do. And there are, in various parts of the state, there are programs going on to help address this. And you're in Chittenden County, and in Chittenden County we do have a group which is, I think, making progress with this problem, the Chittenden County Opioid Alliance. Can you talk about this a little bit?
Well, I mean, I think what, first I want to reinforce the fact that yes, we have no doubt about it. We have a problem. Vermont is not alone, and Vermont has been at the forefront, and across the country, Vermont is oftentimes looked at for what have we done, because we were one of the first states to have a coordinated system around medication, and medication-assisted treatment means methadone or Suboxone, along with counseling or help with some basic needs around connection to housing or job training or things like that.
Right.
Structures such as the Opioid Alliance give a way for the multiple branches of both government as well as the human service professional or agencies,
right,
to have a place to come and talk about what they're doing, or also maybe we have a challenging situation, and so that's really a lot.
It's a way for everybody to work together.
Exactly.
To try to come up with something whereby people, when they need services, can get it. Mm-hmm. That's really what it is.
Right, exactly. And I think what you said in terms of bringing people together, we don't do well in supporting Vermonters in most anything if we keep siloed.
Right.
We need to talk to each other, because the answers and the responses of how we can assist people to meet their potential, work, and enjoy Vermont is if we intersect.
Right, and the idea of when a person is an addict and says, I want help, I think it's extremely important that someone is there at that moment. Now, the United Way of Chittenden, or the United Way of Northwest Vermont, has a program now called Turning Point of Chittenden County, and the purpose of this is they have people who work for this. Like there's the video, they have this young man named Cam, and he's great. I mean, he's ex-addict, and they show a photo of him picking up the phone and going to the emergency room, mm-hmm. and someone who wants treatment is sitting there, and he is right there to talk to this person. Now, that's great.
It's absolutely great. Turning Point is a fabulous organization. It's a nonprofit organization. There are a couple of other nonprofit organizations across the state who are trying to do similar things. A person struggling with opioid use disorder or any other kind of substance use disorder, as they are taking their journey to become clean and sober, they need to find a new community. They need to be supported. They need to be able to go to a safe place and drop in. Mm-hmm. And the Turning Point is that. And the Turning Point from the what you were referencing in terms of the United Way film, with help from United Way, and as well as from, I think, Howard Center, are putting in place people in the emergency room.
To be there.
To be there.
Yep.
Both people skilled in, both professionals in terms, and as well as people who identify as someone who has been struggling with substance use disorder, and so that a person who goes to the emergency room and says, I am ready, they at least have a touchstone right there.
Absolutely. Now, I'm a breast cancer survivor, mm-hmm. and I remember when breast cancer, to talk about that was a no-no. Mm-hmm. And of course, all the publicity and the president's wives, Betty Ford, who went out there mm-hmm. and said, I have it, mm-hmm. and all the publicity helped get the services that people need. Mm-hmm. And I'm quite, I hope people won't take this wrong, but I'm quite into the fact that now when a young person dies of drug addiction, many times the family will have it in the obituary.
Mm-hmm. Mm-hmm. I mean, I think that what we are, I have noticed that as well, and what I have also noticed is that whether it's a child or whether it's another family member, that when someone dies unexpectedly, and that unexpectedly is by suicide, that I am seeing it more frequently in the obituaries, more explicit.
Right.
And I think that that is an important element in alerting us that this is, and that this can happen to my next door neighbor. It's not those people
Right.
over there. It is the people who I know and love and are in my community.
Absolutely. I'm talking with Ann Pugh, and she's the chair of the Vermont House Committee on Human Services. You mentioned suicide, so I'd like to go on with that idea. Many times people who take their own lives have needed, help with mental health problems. And many times we read about, somebody's gone off and shot someone they know or someone they don't know. We talk about mental health problems. Of course, we know the guns are there too. But you're a social worker. Do you think that we don't have enough mental health available for the people who need it? Are we missing something here?
You're saying lots of things.
I certainly am.
And asking lots of and lots and asking lots
This
of
is a
questions.
conversation. I always do that.
It is no secret that not everyone can access mental health treatment. That it's not available in the format or the way or the timing for people who need it or want it across the state. And it's no secret that is still there's still a stigma attached to self-identifying as
Right.
someone who is experiencing a mental health crisis. To say that mental health, someone struggling with mental health, if they had that addressed, that we wouldn't have gun violence.
I didn't really say that.
Okay, good. I want
Yeah,
to because
yeah.
that's not going to happen.
Right. But many times, the President of the United States talks about mental health problems with people shooting other people in these mass shootings.
I appreciate that you are reporting what the President of the United States says. I would be looking more to what people who are familiar with the situation and with the individuals say.
Right.
This will take to address gun violence in this country and in our state will require multiple different interventions related to guns, related to access to treatment, related to building community so that people don't feel isolated or people feel supported, that the fact that they don't fit the mold is not a bad thing, but rather they're accepted for who they are.
Right. Let's talk about this. Let's talk about community. When I was growing up, I grew up knowing a lot of different people of different ages. It seems to me now that we're becoming more and more fragmented. We're with our own group. And you can look at various places in society and you can find a group of people doing something, and they aren't of all ages, and they're all different kinds of people. They're all kind of the same, doing their thing. And the phones make it worse, don't they?
Well, as a teacher, the phones make it hard, I'll say. But as you were talking, I just could not help thinking about what I believe South Burlington did so well this summer, and it's the fourth summer in doing it. Every Thursday night in the summer, they have, they call it South Burlington Night Out. And there are food trucks at the park and music. And you go there and you have little kids running around, and you also have, I've seen, and people my age and your age and everything in between. It is a real community event where in fact you do see people interacting and going together and talking with each other. And I love, I put that out as an example and think that we need to continue to do those things.
Right, right. Block parties, community parties. And you mentioned music. Music is a great way to bring people together. Free concerts, free events. If you know,
Which is what this was,
show up.
right?
Yep. Just show up. Just come.
It's sort of what some of I happen to like jazz. The Discover Jazz Festival. There's some things that cost money, and then there's music on the street.
Right.
Or if you're going to have dinner, there's music there,
Right.
and that brings people of all ages out. And your high school and middle school kids playing in front of City Hall.
Right.
It was wonderful.
Yeah. Our old next door neighbor Tom Cleary had his jazz band there. You know.
Yeah.
Great fun.
Exactly.
Yep. Absolutely. Yeah, and I interviewed Steve McQueen from the Flynn, and he said it was a huge success this year. He said, people on the streets just having so much fun.
That's what community is about.
Right.
Bringing people
Absolutely.
together in something that they enjoy.
We talked about children and daycare. Daycare is something which I struggled. And I'm sure that many other people did, and we're still struggling. And it's so important. And many daycares have Head Start programs too for kids. And this is the age to grab people, isn't it? The little kids.
It is. It is. It's a wonderful investment, and we need to make it. And the research is very clear that when young children have access, to robust environments where there are people, whether it's their parent, if their parent can stay home, or a child care facility where they can learn and play, they will do better. They'll be ready for school.
Yeah.
Ready for school means that they're more likely to be successful. And oh, thank goodness, there'll be people to take care of me when I need someone to take care of me.
Absolutely, absolutely. No, I read someplace, probably somebody said this, but probably some sociologist, but playing is children's work.
Yes. As you're talking about childcare, I guess I do want to pat on the back the Human Services Committee who spearheaded Vermont's response this year, where along with this was a multi-party, Democrats, Republicans, Independents, and progressives, and the House and the Senate and the governor. We worked together. We put, for Vermont, a huge amount of new money into supporting affordable, accessible childcare, and a little bit of money into assisting to expanding who is eligible so that it is more affordable.
Well, I think that's just wonderful, and we need, we need more support on that end of the spectrum. We absolutely do, because the best health care dollar you ever spent is when somebody's in the tank.
Absolutely.
I mean, that's where, if you come out healthy, I mean, then and your mother's healthy, then that's a very, very fine start for you. We as Vermont, you mentioned this too. We have an aging population, and there's a lot of gray hair around like mine.
We're not alone. I just thought I'd say we're not alone. The country is experiencing that. It is perhaps more telling in the Northeast. So we're no longer the oldest state. I think we're number 3 now. We might be number 2, but it is something that is particularly challenging for the northeastern states.
So we have an aging population, which is going to need long-term care, care for Alzheimer's. And we have a young population, which has so many needs which have not been met, which we have talked about. And along with this, we have health. Now, do you believe that health care is a right?
I believe that everyone should get the health care that they need when they need it. it's very, I mean, it's one of the basic things that impacts all of our life. If I'm not healthy, I can't go to work. If I'm not healthy, I can be on the, if I don't have access, if I don't start out healthy, and then if I need health care, I should be able to access it so I don't get worse off.
Right.
But on some level, and health is multidimensional. It's not just physical health, it's emotional health, it's access to food, and a place to live,
Right.
enough food, a place to play.
Yeah, right. It's a multiple member problem. We have multiple things which just plug into this, and we have to try to address them, all of them, as we can, for sure.
And none of the things that we are experiencing in Vermont or elsewhere have a single solution that we can go, we do this and we're done.
No, it's a complicated issue, extremely complicated. Absolutely, you're right. And on the federal level right now, human services are being, the funds for human services are being cut. We all know this. And yet we find in Vermont basic needs. You mentioned food, housing. I mean, you know, healthcare. These are things that people absolutely have to have. The feds keep cutting. How can a state like Vermont, a little state, which is relatively poor, how can we keep trying to plug and keep going to these cuts are here?
We don't have a choice. They're Vermonters. They're our future.
Right.
They're our community.
Yeah, our community. And we have to, everybody out there is our community. Absolutely. Yeah. As John Kalaki said, everybody belongs at the Flint. Everybody belongs in Vermont. I mean, you know, that's for sure. One quick question as we end up here. You've been in politics and fighting all these issues for a long time. Do you think we need more women in the political world, in government, and why?
Yes, we need more women. We need more women so that our voice is continued to be heard. Vermont is the only state that's not sent a woman to Washington. But we need, whether it's women, we need people who represent Vermont. And we're making strides that way, but we need to make more strides so that the people who are making these decisions look like the people who are living in Vermont.
Okay. Well, you look like that. Thank you for coming.
Thank you, Kay. I love chatting with you. It's quite wonderful.
Great. Thank you for joining us on Conversations with Kay.